Welcome. This is our Valuing Our People Award, and with me, Richard Duggins, consultant psychiatrist and clinical lead, Cumbria, Northumberland, Tyne and Wear NHS Foundation Trust, and this is the Staff Mental Health and Wellbeing Hub, and also the sponsor, Eric Finton James, Senior Operations Director, Life Sciences, is GXO? Yes.
Correct.
If you'd like to say a few words.
Thanks, Victoria. I think for the judges, all of the regional winners were potentially worthy champions. The thing that we were really looking for was the impact on the most number of colleagues, system-wide impact, and potential to kind of replicate this nationwide. And I think this is where North East and Cumbria really stood out. So congratulations again, Richard. It's really inspiring, even just talking to you this morning in terms of what you've achieved, the journey you guys are going on. So yeah, worthy winners. It was a real privilege for us.
Well, it is really interesting, and I'm quite. We were just saying, weren't we, that there has been so much about the health and well-being of health and care staff, and particularly during COVID, we saw what the problems were with burnout and psychological distress. But then it seemed to go quiet. What was it that inspired you?
So we wanted to respond to that because, yes, rates of psychological distress, burnout, mental health staff did skyrocket during COVID, but they've stayed just as high. They haven't gone down. So it's really important we carry on responding in the way that we did. And what we simply wanted to do was ensure that health and social care staff could reach out easily for help, and they could get that help before they reach breaking point.
So describe what you've done.
So what we've done is we've set up our North East and North Cumbria Staff Wellbeing Hub, and that allows health and social care staff to reach out for fast psychological expert help, and we cover the whole of our health and social care population. So that's 175,000 people in our area, and whether that's in the Foundation Trust, whether that's in primary care, whether that is in the VCSE, whether it's in social care, any partner organisation, the whole system we will cover.
That's huge. You describe here in the briefing, you're talking about two guiding principles. Explain for those who don't know this.
Okay. So our guiding principles are: how can we get really good? How can we help staff access us really easily and quickly? So staff can self-refer. When they contact us, we'll get back within the day. They'll get an appointment within a week with an expert, and they will be then offered therapy or intervention straight after that. No waiting, no kind of hoops to jump through. That's the first one. The second one is confidentiality. So we want people to come through, to trust us, to know that this service is for them, and they can tell their story, we'll listen, and we'll get the right treatment for them.
What are they coming to you with?
So the majority of staff are coming with us with three things. They're coming with burnout, they're coming with anxiety, or they're coming with depression. And what's quite common is it's a number of those things. And some of the things are produced by work, some are produced by home, and some are work and home together.
It sort of strikes me that, you know, you're talking about 175,000 health and social care staff. You're talking about a vast area geographically. How do you actually supply the demand? I mean, that's a lot of work.
Yes, but we do supply the demand, and we've managed that. We're
because you have other jobs, presumably, other things to do, presumably.
Yes, but we do it, and I think that there has been that worry: will this be too much? Can we sustain it? But we have sustained it. We are doing it. We started off, we were seeing about 40 people a month. We're now seeing well over 200 people a month coming through to us, and we're still keeping those targets of returning those calls in the day and keeping the therapy going. So we managed it. We can deliver it, and we're still getting those fantastic results.
So what is the core delivery?
So we deliver. So the core delivery is people will come to us, and we'll see them very quickly, and they'll meet with a an expert psychological professional. That's what they'll meet with first, and we'll listen, we'll understand the problems, we'll form a plan, and then they can go on after that without any waits for some brief sessions with that person. For a lot of people, that is enough. If we get people in quick enough, we can turn things around quickly. But we can also offer, without any wait, some individual therapy. We can offer group therapy. And what we've done is we've listened to the feedback of the staff coming through. So we're also offering now support for people going through the menopause. We're offering support for neurodivergent colleagues. And we've also started more recently offering support for people with musculoskeletal disorders as well. So we're alcohol and addictions. So we're kind of evolving things as we're getting feedback and noticing what people want.
It says too that it's being independently evaluated, which of course is important, but what are you seeing in the early outcomes?
Yeah, so the early outcomes are really exciting, but we've also this month got the independent evaluation back, so I could share a little bit of that.
Oh yes, no,
like.
do. Yeah.
So there's two parts for that. There's interviews with the staff who've gone through, and they are really encouraging. So it's a good job it's independent, because we've got 100% patient satisfaction. 100% of people said they would recommend this to a colleague. It's incredible. And people are saying we're a lifeline, we're helping them stay at work, we're helping them refine their joy in work when they've lost it. But the other thing with the independent evaluation has been a quantitative bit of it. So our symptom improvement is very high. About 80% of people are improving their symptoms of depression and anxiety by a clinically significant amount. And then the final thing is, and this is something we're really proud of, is the return on investment. So every £1 that the NHS is putting into our system, we're giving NHS and social care £3.10 back. So it's moving really from a not how can we make the argument to fund this service, but almost how can we make the argument if we're not going to fund this service, I think.
Yeah, and it's awful to always have to bring it down to numbers like that, isn't it? But it's critical in the NHS as it is. And we know, it's been talked about here at this conference. I'm doing a session in a little while with Duncan Barton about, the need to improve staff morale. What I'm interested, you said right at the beginning that the numbers have gone up since COVID. Is it that they were there before COVID and they just weren't being recognised and COVID shone a spotlight on it? Or is it something that has happened as a consequence of COVID?
Well, certainly COVID did shine a spotlight, you're right. But the burnout figures were going up before COVID. They then skyrocketed during COVID, and they've stayed sustained. And when we're meeting with staff, what they're telling us is they feel like they've run a marathon, they feel like they've run another marathon, and now they're being asked to run another marathon. And they see the value and importance of that. We've got a really exhausted, burnt-out workforce that we need to support.
Is this a model that can be rolled out?
It is, absolutely. Especially now we've got the independent research showing these results, I think it should be something that each region should consider and see how they could adapt it to their particular area. But I think it could also work in other sectors, this idea of reaching in quickly and confidentially. And we've had some interest, for example, from the police, whether it could work within that sector. So I think it's a really interesting model, and I'd like people to take an interest in it.
Yeah, we could probably do with it in the media, actually. There is a quote here from a nurse who said, "The hub gave me strength and determination, which was pivotal to my recovery and return to work." And we know how many staff have been lost because, I interviewed somebody last week. She's a midwife. She said, she's gone to the system because she wasn't helped deal with her burnout.
Yeah, and absolutely, and I think if we want the NHS to provide compassionate and safe care, and in order to do that, we need systems that look after the staff that are delivering that care, so we're not losing them from the system in the way that you described.
Well, congratulations on this well-deserved award. Thank you so much.
Thank you so much.